If you're watching this video, you might be scared. You might be in pain, noticing blood in the toilet, or feeling so tired that you can barely get through the workday. And the worst part, you don't know why. Is it something you ate? Is it the stress? Or is it something lifelong like ulcerative colitis or Crohn's disease? Hello everyone, I'm Dr. Kapil Dhingra, a consultant gastroenterologist working in the UK. In my clinic, I see patients every week who have been suffering in silence, sometimes for months, sometimes for years. Often it's because they were too embarrassed to talk about their symptoms, or they just didn't know how to navigate the system to get a diagnosis. And today, I'm going to walk you through the exact roadmap of getting diagnosed. In this video, we are going to cover the red flag symptoms you shouldn't ignore, how to actually talk to your GP regarding your symptoms, the specific blood test and the stool test you need to know about. And finally, I'll demystify the endoscopy procedure so you know what exactly to expect. By the end of this video, you will have a clear plan to get the answers you deserve. So let's get into it. First, let's talk symptoms. Crohn's and colitis are what we call inflammatory bowel diseases, or IBD. These cause inflammation or ulcers in your gut. But what does that actually feel like? The classic symptoms are diarrhea that won't go away, blood in your poo, might be unexplained weight loss or extreme tummy pain. But here's the thing that catches people out. It's not just about your gut. Many of my patients are surprised when I ask them about their joints or their skin or their eyes. But IBD can actually affect your whole body. You might experience extreme tiredness or fatigue. You might experience joint pain, mouth ulcers, or even eye issues. And importantly, symptoms can fluctuate. You might have a good day, you might have a bad day. Please do not fall into the trap of cancelling your doctor's appointment just because you feel a bit better on the day. If you have these symptoms, we need to check them out. Now, let's be real. Getting a GP appointment right now, it's hard. And when you finally get one, talking about your bowel habits can be incredibly embarrassing. I hear this all the time. Doctor, I didn't want to tell anyone what was happening in the toilet. Here's my advice as a consultant. Your GP has seen it all before everything. To them, this is just a medical symptoms, like a cough or a rash. They need to know the details to help you out. Here's your game plan for that day of appointment. Number 1, write it down. It's easy to freeze up in the room. Write down your concerns beforehand. Mention the most important symptoms that is bothering you most so that you don't forget if you run out of time. Number 2 is don't sugarcoat the impact. Tell them exactly how it affects your life. Are you missing work? Are you afraid to leave the house? And number 3 is the exit strategy. Before you leave the room, you need to know what happens next. Ask some specific questions like, could anything else be causing my symptoms? When and how will I get the test results? And most importantly, what should I do if your symptoms get worse before I see a specialist? Having these answers gives you a safety net while you wait for a specialist appointment. And finally, you can bring backup. You can bring someone with you because medical appointments can be overwhelming and it's hard to take everything in. You can bring a family member, friend along. They can help support you and remember what was said. Okay, so you've seen the GP. What happens next? There's no single magic test for Crohn's or colitis. We have to build a picture. First, we look at blood test. And here we are looking for 2 important things. So one is the anemia. Low iron levels might mean you are not absorbing nutrients properly or you're losing blood slowly in your gut. The second is inflammation. We look for markers that show your body is fighting something. Your GP might also check for celiac disease as the symptoms can be remarkably similar. Then comes the test that is arguably the most useful, and that is the stool sample. I know it's not pleasant collecting poo in a pot, But this test checks for a protein called calprotectin. Think of calprotectin like a smoke signal. If there is inflammation or fire in your intestine, white blood cells rush there and release calprotectin, which is like the smoke. A high level of calprotectin suggests active inflammation. This is a strong sign we need to investigate for IBD. However, depending on your age and local guidelines, your GP might use a different test called a FIT test instead. This looks specifically for blood in the poo to rule out other conditions first. So if you're offered a FIT test instead of a calprotectin, don't worry. It's often the standard protocol for certain age groups. If your test shows signs of inflammation, your GP will refer you to a specialist team like mine. This is where we usually talk about endoscopy, and this is the gold standard test. We need to actually see the lining of your gut. There are two main types of endoscopies you might encounter. First one is a gastroscopy. This is where a camera goes down your throat to check the stomach and the upper part of your small bowel. And second is a colonoscopy. This is where the camera goes into your bottom to check the large bowel. I know this sounds scary, but let me reassure you. You're usually offered sedation to help you relax. It's not usually painful, but it can be an uncomfortable procedure. For a colonoscopy, the hardest part is actually the prep. You have to drink a strong laxative the day before to clear everything out so your doctors can see clearly. During the procedure, we take tiny tissue samples called biopsies. These are crucial. Some conditions like microscopic colitis can only be seen under a microscope. To the naked eye, the bowel might look totally normal. So those biopsies are essential for the right diagnosis. So the test is done. What do the results mean? It usually takes a few weeks to get the biopsy report back. The diagnosis is ulcerative colitis. It means the inflammation is in your large bowel. We categorize it by how much of your large bowel or colon is involved. It could be proctitis, which is just the bottom end. It could be the left-sided colitis when it involves only the left side, or it could be pancolitis, which affects the whole colon. If it's Crohn's disease, it can be anywhere from your mouth to your anus. Common spots are the end of your small bowel called ileal Crohn's or around the bottom. Sometimes we genuinely can't tell the difference between the two. We call this indeterminate colitis or IBD unclassified. Don't worry, this is still a valid diagnosis and we treat it very similarly. But what if they find nothing? If your endoscopy looks normal and the biopsies are clear, it might be something like IBS. But if you feel in your gut that something has been missed or your symptoms get worse, please go back to your doctor. It can sometimes take a time to reach the correct diagnosis. Keep a symptom diary. And if you're really not happy, you're entitled to ask for a second opinion. Getting a diagnosis is a journey. For some, it's quick. For others, unfortunately, it can take time. But putting a name to your symptoms first is the first step to getting your life back. Once we know what it is, we have incredible treatments available today to try to get you into remission. If you're waiting for a diagnosis right now, hang in there. Be kind to yourselves. This is a stressful time. I understand. And if you found this helpful, please subscribe for more honest and consultant level advice on your gut health. I'm Dr. Dhingra and I'll see you in my next video. Thank you.